The FUE technique is the most modern way of hair restoration nowadays. It was developed in 2002 and it's still developing as an answer to the older techniques and the problems they have caused, mainly the significant post-operative pain and scarring after hair restoration procedure. So the answer was the development of a new technique called Follicular Unit Extraction, FUE, meaning that we perform hair restoration by extracting single hair follicles with special instruments, one by one, taking advantage of the whole donor area and not just a specific part of it. You see, older techniques, mainly punch grafting and strip technique, which is largely still in use worldwide, was that in order to extract the needed hair follicles for the hair restoration, they would take advantage of a small part of the donor area by excising a strip of skin containing the hair follicles. This would require stitching after the procedure, and as you understand, it would produce, no matter how good or experienced the doctor was, a large, sometimes painful scar in the back of our scalp. So we had to develop a new technique in order to harvest the hair follicles needed for hair restoration with a more, let's say, patient-friendly and less invasive manner. That's why the FUE technique was developed. The main difference between the strip and FUE technique is that FUE is much less invasive as a procedure. It does not have a painful post-operative course. It does not produce a permanent scar, which is the case with the strip technique. And most importantly, it does not destroy the donor area. The donor area with FUE can be used again and again for future sessions if needed. While in the strip technique, by having a permanent scar at the back of the donor area, it is very difficult to perform a second or third procedure on top of the scar. This would destroy the donor area and would cause the existence of permanent scars all over the place. You see, in FUE, we extract single hair follicles with the use of a tiny instrument measuring 0.8 to 0.9 millimeters in diameter under magnifying glasses. This is the only way to do it. And we extract from all over the donor area. This means that we take better advantage of our donor area and we can still use it again in the future if needed. FUE is not painful. And the reason is, as I described earlier, that is minimally invasive. We don't need to cut any skin or put any stitches. So there is no tension in the back of the scalp. And believe it or not, most patients after an FUE sessions don't even require a single painkiller. So the post-operative course is largely uneventful and painless.